In the labour ward at Maternal Hospital, Napak District, located in the remote Karamoja sub-region, are 3 women being treated for Hepatitis E virus. The virus triggers liver inflammation, leading to the death of the patient.
Most of them, that when they come when they're like 22 weeks pregnant, 20, 33. Most of them, they come during that period of gestation.
20-year-old Veronica Longora is one of those afflicted by this disease.
She reported on the 2nd of this month with the yellowing of the eye. So we admitted her and put her on IV fluids, which got finished. And when they saw that the yellowing of the eyes was clearing a bit, then they started telling her to take a lot of water.
Females are the most affected, with about 55% of the cases, and the male constitute only about 45% of the cases so far.
Veronica is one of the lucky women that have survived the adverse effects of hepatitis E. Her baby is also doing perfectly well. Hepatitis E is something that is very dangerous, especially to the pregnant woman.
The baby is okay, breastfeeding well. She doesn't feel anything bad at the moment. When she came is when she felt that she was not okay.
But that has not been the case for most of the other pregnant women who are diagnosed with hepatitis E. According to the 2011 Uganda Demographic and Health Survey, while the maternal mortality ratio in the whole country is at 438 deaths per 100,000 live births in Karamoja, it is at 750. And the fact that hepatitis E is mainly claiming the lives of pregnant women implies that it will be higher. The district's health officer says the rise in maternal and child mortality deaths as a result of hepatitis E will negate any gains that have been made under the Millennium Development Goals. Out of the 15 deaths as a result of hepatitis E recorded at Maternal Hospital, the superintendent at the hospital, Dr. Baifa, says 10 have been pregnant women.
Some of these mothers that were brought at the hospital were discovered during polio campaigns, family health days, so I believe some of the deaths are not actually reported.
Most have come with almost all the hepatitis E signs: yellow eyes, yellow urine, heart problems, preterm labor, headache and joint pains, general body weakness, loss of appetite, as well as an altered mental state. For some, though, the signs are negligible.
Case fatality so far for our pregnant mothers has stood at 77%.
There is a concern that the patients always come for treatment when it's too late to treat the disease.
Most people stay in the community and don't go to the health facilities. There is a cultural perception of this epidemic, and most people are treating this with the pawpaw roots, raw pawpaw fruits, which are cooked and given to the patients, and also other concoctions.
Between the months of May and September 2013, 6 mothers died of hepatitis E, a figure which underscores the grim statistics. The hospital, which lacks modern equipment, can barely do much in saving the lives of those who are critically ill.
Like some intensive care equipment which the hospital does not have. So management of mothers who are brought in coma has been a challenge.
There is also acute blood shortage across the Karamoja sub-region.
Some of these mothers, have got bleeding tendencies. Liver disease causes bleeding. So when they start bleeding, they need to be transfused with fresh blood, which we do not have as a district. So the only blood that we have in the hospital is blood that is stored, which will not help a mother with liver disease.
Though hospital staff and a few residents often donate blood, it's hardly enough to cater for the needs of the sick. Why does it hit them so hard? Why does it hit these women so hard?
What I know is that the disease is more severe among the pregnant women. The actual reasons why it is more severe among pregnant women, I do not know, but it manifests severely among the pregnant.
A preterm baby lies in this incubator. Her mother has just recovered from hepatitis E.
The baby has been kept here for some time, but the baby has gained now, it's around 1.8. We give the baby NAN1 and then express breast milk from the mother.
The baby is lucky to be alive after 2 preterm babies recently died.
The heat within this incubator is not enough to, sustain the temperatures.
Many prematures are abandoned at the hospital by their relatives after the death of their mothers. Clean water is used to treat the pregnant women here at Maternal.
We've been managing them according to the symptoms they present with.
There should be a word of caution here. We do not tolerate all the drugs because they also injure the already sick liver.
We always put them on complete feeding, and we also, if they are to prepare their own food, we encourage them not to eat proteinous food, but we encourage them to eat more of the carbohydrates. They should stop eating some things like beans.
The mothers are also given a bar of soap weekly and clean water. This has encouraged more women to come to the health centers. However, there is fear that the disease will continue to ravage Karamoja unless they improve their hygiene.
Open defecation here in our region here, it is the order of the day, and the latrine coverage for my district here in Napak is about 22%.
Sometimes even in villages where there are latrines, actually people defecate everywhere else except in the latrine.
Whereas many continue to die of hepatitis E, many continue to ignore the health warning. On our way back, we found a woman fetching water from a contaminated source. The chance of this woman contracting the disease, just like others that depend on this water source, is high. Florence Salimba, NTV.